Welcome to the deep dive. Today, we're going to explore a healthcare option that seems to be popping up more and more, the Polyclinic.
Yeah, it's definitely a term you hear more often now.
Absolutely. And we've gone through quite a few sources to get a handle on this, looking at international standards like JCI, India's NABH guidelines, insights from healthcare consultants like Supremedic.
And even hospital network blogs like HospiMatch, plus some general patient info. It's a good mix.
Right. So our mission here is really to understand, okay, what is a polyclinic? What can you actually get done there? How does it differ from, say, your local clinic or a full hospital?
And what are the real benefits? Who should actually think about using one? That's what we want to unpack.
We want to give you the inside track so you can figure out if it's a good fit for you or your family.
Exactly. Moving beyond just the definition to see where they really add value.
Yeah.
Is it just convenience, or does it genuinely improve things sometimes?
Good question. So let's start there. What exactly is a polyclinic? Based on everything we looked at, the core idea seems pretty consistent.
It's essentially a multi-specialty outpatient center.
Right. You go there for doctor consultations, tests, maybe some minor procedures, but critically, no overnight stays.
Yeah, that's key. It's outpatient only. Think of it as, well, more advanced than a basic clinic with just one or two doctors.
But definitely less complex and less equipped than a hospital.
One source called it a one-stop health center, which kind of captures that feeling, doesn't it?
It does. And that multi-specialty part seems crucial.
Oh, absolutely. That's the big differentiator from a standard clinic. You're not just seeing a GP.
You might have several different specialists available.
Exactly. Different types of doctors working under one roof. And that opens up possibilities for, more integrated care, perhaps.
Okay, so what kind of services are we typically talking about? The list seems pretty broad.
You can be, yeah. You'll usually find general practitioners, of course, but also specialists. Things like dermatology for skin issues.
Right, or ENT for ear, nose, throat, orthopedics for bones and joints.
Yeah. Gynecologists, pediatricians for kids. And sometimes, in the bigger ones, you might even find cardiologists or physiotherapists.
Physiotherapy seems quite common. Maybe even mental health support, like counselors.
Potentially, yes.
Yeah.
And a really big piece is the on-site diagnostic lab.
Ah, so you can get tests done right there. Blood tests, urine tests.
Usually, yes, which can really speed things up. And interestingly, a few sources mentioned NABL certification for these labs, especially in India.
NABL, what does that signify?
It basically means the lab meets certain quality standards. So you have some assurance about the accuracy of the results. It's something to look out for.
Good to know. So lab tests, what else? Basic imaging, maybe?
Often, yes. Things like x-rays, ultrasound, maybe ECGs. It depends on the specific polyclinic, of course.
And it adds another layer of convenience for that initial diagnosis, right?
Definitely. And then you have minor procedures. Think simple stuff like getting a dressing changed, injections, wound care.
Nebulization for breathing issues.
Yeah, things like that. Minor interventions that don't require hospital admission.
There also seems to be a focus on preventive care.
Very much so. Vaccinations, routine health checkups, maybe dietary advice.
Screenings for common conditions like diabetes or high blood pressure.
Exactly. And as you mentioned, physiotherapy is often available. Plus, having a pharmacy nearby or even inside the polyclinic is another convenience factor.
Saves another trip.
Right. They really try to cover a lot, including specialized care areas like dermatology, gynecology, ENT, orthopedics, even family planning advice.
Okay, that sounds quite comprehensive for outpatient care. But let's clarify the distinctions. How does it really stack up against a regular clinic or a hospital?
Yeah, that comparison is helpful. Think of it in tiers.
Yeah.
Your basic clinic usually has maybe one or just a few doctors, often GPs. Focus is mainly on consultation.
Got it. Simple stuff.
Then the polyclinic is the middle tier. Multiple specialists, those diagnostic tests on site, minor procedures, but still no overnight stays.
And then the hospital is the top tier.
Right. Full medical teams, lots of different specialists, advanced equipment, major surgeries, intensive care units, ICU, and of course, overnight admissions.
So if we break it down, doctors one versus multiple specialists versus a whole team.
Services consultation only versus consults plus tests plus minor treatments versus the full spectrum, including surgery and ICU.
Equipment basic, moderate, advanced.
Admission no-no, yeah.
And cost usually follows that pattern too. Clinic lowest, polyclinic medium, hospital highest.
Generally, yes. That's the typical structure. Which brings us to the benefits, right? Why choose a polyclinic?
Good point.
Huh.
What are the advantages? Time saving seems like a big one mentioned in the sources.
Huge. If you need to see, say, a skin doctor and also get a blood test, you might do it all in one visit.
Instead of 2 separate appointments, different locations.
Yeah.
Yeah, that adds up.
And cost effectiveness for non-emergency outpatient stuff. It's often cheaper than going to a hospital for the same consultation or test.
The convenience of tests and imaging right there is also a major plus. Streamlines the whole process.
Definitely. And for families, the idea of one place serving adults, kids, maybe elderly parents, that's appealing.
Centralized care for the whole family.
There's also the potential for better care coordination within the polyclinic.
How so?
Well, if the specialists are all working together, referrals between them can be quicker, maybe smoother, less chance of communication gaps compared to seeing separate doctors in different practices.
That makes sense. Having primary and specialist care under one roof could lead to a more holistic view of your health.
Potentially, yes. Maybe earlier diagnosis or better management because the information is shared more easily. Some sources hinted at that.
And maybe shorter wait times than a busy hospital outpatient department.
Often, yeah. And perhaps a feeling of more personalized attention because it's typically a smaller setup than a massive hospital.
Plus, for people in areas with fewer specialists, a polyclinic can really improve access to that kind of care closer to home.
True. But we need to be clear about the limitations, too. It's not a mini hospital.
Right. Expectations need to be managed. What can't they do?
Okay, number 1, no overnight stays. No missions.
No emergencies. If it's serious, you go to the hospital ER.
Absolutely. No major surgeries, no ICUs. They aren't equipped for trauma, childbirth, critical illnesses.
So definitely not for life-threatening situations. Hospital is the place for that.
Without question.
Okay, so given those boundaries, who should consider using a polyclinic? Who's the ideal patient?
Well, anyone with ongoing or non-urgent symptoms that need specialist input seems like a good fit.
Like a nagging skin condition or joint pain that needs checking out.
Exactly. Also, families looking for affordable, regular care across different needs, checkups, vaccinations, minor illnesses.
What about older adults?
They could really benefit, especially if they need checkups for multiple things, heart, joints, diabetes management, etc. Having it coordinated might be easier.
And people managing chronic lifestyle diseases, diabetes, blood pressure, thyroid.
Yeah, for regular monitoring and specialist consultations, it can be very convenient. And routine pediatric visits or vaccinations for kids, too.
It sounds like it covers a lot of everyday healthcare needs. Now, what about misconceptions? Are there common myths?
There are a couple. One is that polyclinics are, only for lower income people.
Is that true?
No, sources suggest people from all backgrounds use them. The draw is efficiency, convenience, the range of services, not just cost.
Okay. What else? Maybe concerns about the doctor's qualifications?
That comes up. People wonder if they're as qualified as hospital doctors. But actually, many polyclinics have board-certified, experienced specialists. Some even work in hospitals, too.
So they can be highly qualified.
Absolutely. And another point is about the tests.
Sure.
Are the lab results reliable?
We touched on that with the NABL certification.
Right. If a polyclinic's lab has an NBL certification, it means they follow strict quality standards. So it's worth checking for that accreditation.
Okay, good advice. So if you're looking for a good polyclinic, what should you actually look for?
Well, first off, check the doctor's qualifications. Look for degrees like MBBS, MD, MS, the usual credentials.
Makes sense. And the certifications we mentioned. NABL for labs, NABH for overall quality.
Yes, NABH accreditation is a big one in India. It's from the Quality Council of India and sets standards for the whole facility, not just the lab. It's a strong indicator of quality.
What else? Clear pricing.
Definitely. You want transparency about costs and just, the general environment. Is it clean, organized?
Basic hygiene and professionalism.
Exactly. And maybe practical things. Does it have female doctors, if that's important for you? Is it easy to get to? Parking, online booking?
All those practicalities matter. Okay, zooming out again. How do polyclinics fit into the bigger healthcare picture?
They really seem to bridge that gap,
Yeah.
between the local GP clinic and the big hospital.
Offering more than a clinic but less than a hospital in a more accessible outpatient setting.
Right. And they can be a cost-effective way to handle a lot of non-emergency outpatient care, potentially taking some pressure off hospitals.
It's interesting that consultancies like Supremedic actually help set them up and get them accredited. It shows they're seen as a growing part of the system.
Yeah, it points to their recognized role.
Yeah.
We also saw that mention of quality set to from NABH.
What was that about?
It sounded like an initiative to connect different players in healthcare around quality standards, sort of building bridges for quality improvement across the board, potentially including polyclinics.
And while JCI focuses more on the big hospitals, ensuring quality and safety.
That underlying goal of safe, quality care applies everywhere,
All right.
including polyclinics.
Okay, so let's wrap this up. Key takeaways.
I think the main thing is that polyclinics offer a really useful middle ground. They're convenient, often cost-effective for many non-emergency needs, and bring specialists and diagnostics together in one place.
They fill a specific niche between the basic clinic and the full-service hospital.
Exactly. A valuable option for many people and families.
All right. And here's something to leave you thinking about. As healthcare keeps changing, especially with technology, how might polyclinics evolve? Could they integrate more tightly with hospitals? Maybe use more digital health tools for things like remote follow-ups?
Interesting point. Or perhaps expand their diagnostic capabilities even further, maybe develop specialized programs tailored to their local community needs.
Yeah, could they become even more integrated hubs for accessible, seamless care right in our neighborhoods? Definitely something to watch.